A shorter working week for everyone. How much paid work is needed for mental health and well-being? This study aimed to answer two important questions. What is the minimum amount of working hours required for greater mental health when compared to being unemployed or economically inactive? What is the optimal number of working hours for mental health and well-being? This study's findings can be summarized as follows. Paid labor considerably improves mental health and well-being when compared to no work. However, differences in mental health between different working hours are not significant. Working 1 to 8 hours per week had a positive psychological impact on the majority of previously unemployed or inactive adults. Although there were some gender differences, the commonalities between previously inactive and unemployed men and women were more prominent. There were a few exceptions, which were most likely due to the intricacies of the UK in work benefits system and how working more than a particular number of hours affects access to other benefits. For example, formerly inactive men's mental health scores improved only after working more than 32 hours. Men who had previously been unemployed or inactive exhibited an increase in life satisfaction when working up to 16 hours, but there was no significant difference when working 24 or more hours. Only when unemployed women worked more than 20 hours per week did their mental health and life happiness increase significantly. Only in the 20 to 24-hour category did inactive women exhibit a substantial difference in life satisfaction. These variances may be explained by the fact that people on income assistance lose benefits if they work more than 16 hours per week, with the exception of those with children, who may be eligible for other benefits. Furthermore, for those with low hourly pay, particularly men, working 16 to 20 hours a week might be difficult because the earnings may be less than the benefits they previously got. This explains why working hours have different effects on mental health and well-being around the 16-hour mark. It is crucial to emphasize that the impacts of benefits on mental health were not thoroughly investigated in this study. The study did not uncover an ideal number of working hours that significantly enhanced well-being and mental health, contrary to predictions. The usual full-time benchmark of 36 to 40 hours per week was not found to be the ideal range. Working full-time was found to be superior than working more than 8 to 16 hours per week for males and more than 40 to 44 hours per week for women in terms of mental health. The difficulty of balancing longer working hours with childcare may explain why full-time employment has some benefits. However, in terms of mental health and well-being, full-time work did not differ significantly from other working hour groups. These findings support existing beliefs and evidence that having paid employment or being re-employed in high-quality positions is helpful for one's mental health and well-being. According to the findings, even a little number of working hours per week can bring significant well-being benefits. Working hours had a minor effect on mental health, which was likely due to various factors influencing mental health and the study of just short-term effects. The study found no significant difference in working hours and mental health based on hourly wage. This could be because the analysis took household income into account, which could counteract the negative consequences of low working hours and income. The study also provides evidence for the feasibility of a shortened work week without negatively harming mental health and well-being. The issue is to develop strategies to minimize and disperse working hours while keeping the benefits of paid labor for the majority of people and preventing growing inequities. To avoid putting persons below the poverty line, it is advocated that working hours be reduced for all, rather than just specific groups. Increased productivity as a result of technical improvements and more efficient work organization may eventually allow for a reduction in working hours without a loss of spending power. These findings have substantial implications for policy conversations about the future of work. While many policy alternatives focus on measures such as universal basic income to assist those who are unemployed, this study recommends a different approach: redistributing working hours in society. Maintaining full employment while shortening the normal workweek could help to disperse the well-being advantages of labor to all workers. This alternate strategy could reduce unemployment, public health costs, CO2 emissions, and promote work-life balance. Despite these limitations, this study contributes to our understanding of the relationship between job, health, and well-being, giving significant insights for public policies targeted at enhancing the quality of life for persons who are unemployed or face labor market disadvantage. The findings also inspire theoretical arguments about the future of work and unemployment, implying the possibility of fairer work hour redistribution and greater work-life balance.